Welcome to Unit 5, Section 2. After listening to this, you should be able to summarize how genetic factors affect prenatal development, describe how a person inherits traits through genes, differentiate between dominant traits and recessive traits, explain the role of the environment on prenatal development, and give examples of environmental factors that can harm a fetus. At the moment the sperm enters the egg, the baby forms traits from both the mother and father. These inherited traits, including any disorders, are merged into a unique new person and influence the child's growth and development throughout life. Development, however, is not determined solely by genetics. Immediately after conception, the environment also begins to forcibly place an influence on the unborn baby's traits. Genetic factors are a person's inherited traits passed to him or her through their parents' genes at conception. Following certain rules, each parent's genes combine to make a blueprint for the unborn child's growth and development. During pregnancy, this blueprint, which we call a genome, guides growth and development. The epigenome, which can turn genes on and off, has a major impact on genes, altering how the genes may function throughout life. And we already talked about this during Unit 2. Through the guidance in the genome and epigenome, the unborn baby changes from a zygote to a baby ready to be born. The child will come to look much like other members of the family. He or she will likely have abilities, interests, and personality traits similar to those of other family members too. During the prenatal period, the genetic blueprint also gives the cells instructions for family-like traits that will unfold throughout life. For example, during the prenatal period, a baby boy's cells receive instructions on hair loss later in life. These instructions determine whether he will be bald, what the pattern of hair loss will be, and whether hair loss will occur. Some people's genes lead them to lose hair, while others have genes that promote keeping a full head of hair. Heredity causes each person to be different. All people begin life as a single-celled zygote. The nucleus, or center of this cell, contains a set of instructions to build a living being. These directions are written in what scientists call a genetic code. The genetic code is stored in DNA, or deoxyribonucleic acid. DNA is a chemical compound found in thread-like structures called chromosomes. The chromosomes carry genes in living cells. All organisms have a certain number of chromosomes. Each human baby receives a total of 46 chromosomes, 23 from each parent, that form 23 pairs in each of the body cells. Germ cells differ from body cells. The germ cells, or the sperm in the egg, do not have 46 chromosomes. Just before the ova or sperm become mature, they go through a cell division process that leaves each egg or sperm with 23 single chromosomes. When the ovum and sperm meet, the single zygote will have 46 chromosomes. It is the final combination of these two sets of chromosomes during fertilization that makes each person unique. Each chromosome has about 20,000 genes, with each gene having a specific location on the chromosome. When examining another cell and looking at the same chromosome, each gene is in the exact same location. The human genome has over 3 billion genes. These genes and the epigenome determine a person's individual traits. Sometimes one gene pair determines a trait. Other times, a group of gene pairs determines a trait. In each gene pair, one gene originates from the father and the other gene is from the mother. The genes the child receives from each parent work together to determine the child's specific traits. In a few genes, only one gene, not a matched pair, determines certain traits for boys because of the XY chromosomes of boys. They're two different, they're X and Y. Okay. Whereas girls are just two X's. So boys are different in that way. The initial laws of heredity were discovered by Gregor Mendel, who was a botanist, which is a person who studies plant life, from Austria. In the beginning, he thought traits were handed down equally from both parents, such as tall and short parent would produce an average height of a child. He was actually studying peas. Okay. Mendel's conclusions, however, did not support the averaging idea. He soon discovered the laws of heredity, which apply to all living beings, are based on dominant and recessive genes. For this reason, different traits come from each parent, and the child may express traits that both parents have, but are not expressed in either parent. Dominant traits are always expressed in a person, even if only one gene of the pair is inherited for that trait. Recessive traits are not typically expressed in a person unless both genes for the trait are inherited, which means one from each parent. A person who inherits only one recessive gene for a trait becomes a carrier of that trait. This makes it possible for the trait to be expressed in later generations. So you may have received a possibility to have green eyes, but you don't have green eyes because blue eyes were dominant. But that means your kid, if your partner has the recessive trait for green eyes, maybe they have blue eyes, but they have a recessive green trait too, your kid could have green eyes. And that's how some people will produce a kid who has red hair, even if both their families have the possibility for red hair. Like my son could have red hair. I know my husband's side carries the possibility. I think my grandma carries the remote possibility on my dad's side, so it is possible if he inherited both those traits. Okay? Person who inherits only one, people who have dominant, recessive, or both types of genes in their gene pair, you have both for blood type. For example, blood type A is a dominant gene and blood type O is recessive. A child who has two blood type A genes or one blood type A gene and one blood type O gene will then have blood type A. A child with two blood type O genes, one from each parent, will have blood type O. Like I'm blood type O, so I inherited an O from my mom and an O from my dad. Even though my mom has A, she has A blood, she must have AO, and I got the O from her instead of the A, and my dad has OO, so I got one of his O's, and so I'm O. However, some genes can get really complicated because most traits involve multiple gene pairs, so they don't follow a simple principle of being dominant or recessive. So that's why hair colors can vary wildly, as well as height can vary wildly in your family. It's because there's multiple gene pairs that are working to determine that overall trait of height or hair color. All right, of the 23 pairs of chromosomes in each cell that you have and babies have, 22 pairs, so chromosomes 1 through 22, are autosomes. The genes in these autosomes are always in matched pair, one from the mother and one from the father, and are possessed equally by males and females. In these 22 pairs of chromosomes, all traits are based on the principles of dominant and recessive genes. Unlike with autosomes, the 23rd chromosome that you have is called the sex chromosome because it determines a person's gender. The gender of a child, however, is determined by the entirety of the chromosome pairs, unlike traits that are determined by only one or a few genes on each chromosome or pair. When viewing the chromosome pairs for females and males under a microscope, the pair for each gender looks different in the following way. Females have an XX chromosome pair because when you look at it under a microscope, the pair looks somewhat like the letters X and X. When a female's chromosome pair splits to form germ cells, aka ova, their eggs, all the ova are X because each chromosome pair is XX, so there's no other possibility. It has to be X. That's why all female cells, all of your eggs are X's. Males have the XY chromosome pair because when you're looking under a microscope, the pair kind of looks like the letters X and Y. When a male's chromosome pair splits to form their germ cells, or sperm, some will be X and some will be Y because each chromosome pair is XY. So because they have X's and Y's, some of them will be X's, some will be Y's. That's why the male determines the gender of the baby. All the mother's egg cells carry the X chromosome. If the egg is fertilized by a sperm carrying an X chromosome, the child will be female XX. If the sperm cell carries the Y chromosome, the child will be XY, and they will be male. Because the father's sex chromosome is the one that varies, he has X's or Y's, the father's sperm always determines the gender of the child. Although the whole chromosome pair determines gender, there are other traits determined by specific genes on your sex chromosomes. Okay, the laws of heredity are slightly different on this 23rd chromosome pair compared to the autosomes. To understand this, think of X as having 4 legs and Y as having 3 legs. A male's traits are determined by the pairing of dominant and recessive genes on the 3 matched legs of the X and Y, just as they are in autosomes. There's no 4th leg of the Y, however, to follow the laws of dominant and recessive genes. This is not the case in females whose sex chromosome pair is XX. All of females' genes will be in matched pairs. For males, either the dominant or recessive genes on the unmatched fourth leg of the X chromosome determine these traits. We call these sex-linked traits. Some sex-linked traits include color blindness and hemophilia, which is a serious blood disorder. Bad. Okay, females would only have these disorders if they receive the recessive genes from both parents. Okay, but they may be a carrier and pass it on to their son. Okay, so that's why males have more of these sex-linked disorders than females, is if you think of it like females have X and X and males have X and Y, if they inherit the bad X, the other X of the female one can be dominant and it can cancel it out because the bad X is probably recessive. Whereas with the males, they only get one X. So if they get a bad X, they have that bad disorder. A genetic disorder is a defect caused by one or more flaws in the genome. Some disorders are inherited from parents as a dominant or recessive trait. Other defects are due to mutations, which is changes in the DNA. If the mutation is in the sex chromosome, it can be passed down to the next generation. Most genetic disorders are caused by a combination of small variations in genes and environmental factors. Chromosomal disorders are defects in the chromosomes. These defects are often more serious than single gene defects because they involve so many genes. Okay, because remember, each chromosome controls like thousands of gene pairs. So if there's a defect in the chromosome, it controls a lot more than if there's a single gene defect. Okay? Chromosome disorders are caused by changes in the number of chromosomes or by a structural abnormality such as the deletion or duplication of part of the chromosome. Chromosomal defects usually occur due to an error in cell division. One example of a chromosomal condition is Down syndrome, which occurs when each body cell has 3 copies of chromosome 21 instead of the 2 copies that it should have. Most chromosome errors occur in the egg or in the sperm, so the defect is present in every body cell. In other cases, the defect occurs after conception, which means some cells carry the defect but others do not. Parents' ages will increase the risks of genetic and chromosomal disorders due to the aging of genetic material that is contained in their germ cells. Environmental factors are caused by a person's surroundings. The prenatal environment is the mother's body, which affects the baby. This means the substances a pregnant woman takes into her body also affect the developing baby. Environmental substances include foods, beverages, drugs, and environmental pollutants like lead, chemicals, pesticides, and herbicides. Each of these substances can negatively impact the developing fetus. An unborn baby depends on the mother for a healthy start. Women with good health habits and a healthy environment before pregnancy most often will have healthy babies. Pregnant women with environmental factors that do not promote a healthy pregnancy are called high-risk mothers-to-be. Environmental factors that can affect the health of pregnancy include the parents' ages and the mother's physical and emotional health. In regard to health, the ideal time for a woman to have a baby is between 21 and 28 years of age. Teens and women over 35 are high-risk mothers-to-be. Because pregnant teens are still growing themselves, their bodies cannot always meet the needs of their developing babies. Women who are over ages of 35 have a higher rate of babies with health problems, disabilities, and disorder. As mothers, they are also more prone to health problems. For many years, geneticists have suspected that a father's age was involved in some genetic disorders. Mutations in the sperm occur as men age, and the number of mutations rise exponentially. For example, at 36 years of age, men pass along twice as many new mutations as men at 20 years of age. By 70 years of age, this number has increased to 8 times the number of new mutations as seen in 20-year-olds. Most sperm mutations are harmless to children, but some will result in disorders. Good health habits prior to and during pregnancy can promote a healthy pregnancy for both the mother and the baby. Good health habits include eating nutritious meals, maintaining a healthy weight, getting plenty of sleep and rest, and getting enough physical activity. When a pregnant woman does not practice good health habits, doctors become concerned. You will learn more about health habits prior to and during pregnancy later in this unit. Other problems that are for concern to doctors include certain illnesses and diseases, high-risk behaviors, such as drug and alcohol use, and emotional stress. Any health problems a woman has before and during pregnancy may play a role in the pregnancy and affect the baby's health. Women should ask their doctors before pregnancy, if possible, how these problems might affect the pregnancy. In many cases, steps can be taken to protect the unborn baby. The doctor will want to monitor health problems more closely during pregnancy. Special testing might be done, and medications or treatments might need to be adjusted for the safety of the unborn baby. There are many illnesses and diseases that a mother can have that affect the baby, including diabetes, pregnancy-induced hypertension, Rh factor, sexually transmitted infections, and rubella. Now let's expand upon some of those. Okay, pregnancy-induced hypertension is the name for high blood pressure that is caused by pregnancy. This dangerous condition can also be referred to as preeclampsia or toxemia. It includes a sudden increase in blood pressure, protein in the urine, and swelling. PIH appears late in pregnancy, but its cause is unknown. If untreated, it can lead to damage or death of the mother, baby, or both. Early treatment, which may include bed rest, medicine, and maybe even early delivery of the baby, can help both mother and baby avoid serious health problems. The Rh factor is a protein substance found on the surface of blood cells of about 85% of the population, mainly among Caucasians. People who have the substance are called Rh positive, and people who do not are called Rh negative. The only time the Rh factor can cause the baby a problem is when the father is Rh positive and the mother is Rh negative. If the baby inherits the Rh positive blood type from the father, the baby may develop Rh disease. Rh disease is a type of blood condition that destroys the baby's red blood cells. Rh disease does not affect the first Rh positive unborn baby. During any pregnancy, however, some of the baby's Rh plus cells may enter the mother's bloodstream during birth. These cells are foreign to the mother's Rh negative system. Her body fights these Rh plus cells by making antibodies, which then makes the mother immune to the blood cells of future Rh plus babies. In the next pregnancy, these antibodies cross the placenta. If the baby has Rh plus blood, the antibodies destroy the baby's red blood cells. A vaccine called anti-Rh immune globulin greatly reduces the danger of Rh disease. It is 99% effective. Sexually transmitted infections are another thing that can affect the baby. They are infectious illnesses contracted primarily through sexual intercourse. STIs are also known as sexually transmitted diseases. The most dangerous STI is HIV/AIDS. HIV, which is called human immunodeficiency virus, is the STI that causes the disease of AIDS, which is acquired immunodeficiency syndrome. AIDS develops when HIV attacks the body's immune system until it is no longer able to fight illness. HIV is spread through sexual relations or by contact with contaminated blood and bodily fluids. Among drug users, HIV can spread through the sharing of contaminated intravenous needles. STIs can have serious effects on the unborn baby. A mother could be infected with an STI and not even realize it because she may not show any signs of infection. This could be extremely dangerous to her unborn baby. For example, some STIs can enter the bloodstream of the mother and cross the placenta to reach the fetus. Others infect the mother's reproductive tract and can pass to the baby during delivery. Still, other STIs can be passed from mother to baby during breastfeeding. If a woman thinks there is a chance she was exposed to an STI, she should immediately communicate this with her doctor. Lastly, rubella, which we used to call German measles, is a virus that can cross the placenta and affect the baby during the first 3 months of pregnancy. For the mother, this disease is mild. Infected babies, however, can be born blind, deaf, with an intellectual disability, or with heart problems. Mothers should have received a MMR, which is measles, mumps, rubella, vaccination for rubella during childhood. The MMR vaccine must be avoided during pregnancy because the vaccine itself presents a risk to the fetus because vaccines are made up of dead cells of that disease. Diabetes is a disorder caused by the body's inability to use sugar properly. In diabetes, the body inadequately produces or uses the hormone insulin. Some women might have diabetes before they become pregnant. If so, they should talk to their doctors about how to manage the disorder during pregnancy. Another kind of diabetes, called gestational diabetes, can occur during pregnancy. Gestational diabetes appears in about 18% of women who did not have diabetes before pregnancy. Soon after pregnancy ends, gestational diabetes usually disappear. Women who experience gestational diabetes, however, have a 35 to 60% chance of contracting diabetes later in life. The chances of developing diabetes increase for their children, too. Careful balance of diet, physical activity, and medication, if necessary, can keep both types of diabetes under control. Pregnant women who have either of these conditions should work closely with their doctors and dietitians to plan for a healthy pregnancy. Okay. Radiation exposure during pregnancy, x-rays that are performed to help diagnose physical conditions should be avoided if possible. This is because x-rays aimed toward the fetus increase the likelihood of childhood cancer. Some studies also link the use of x-rays in pregnancy to congenital disabilities in the fetus. Pregnant women should inform their doctors or dentists of a possible or known pregnancy before x-rays are performed. Women should not work near x-ray or radiation treatment machines or stay in the room when an x-ray is being taken. If an x-ray is necessary before delivery, it must be low in intensity, taken away from the fetus, and done only when the abdomen is shielded by a lead safety drape. Right. Harmful substances like nicotine, alcohol, medications, and drugs can enter the mother's body, pass through the placenta, and reach an unborn baby. Some of these substances can harm the baby in the early months of pregnancy, and many can harm the baby throughout pregnancy. Other drugs, like aspirin, are most hazardous near delivery. When a pregnant woman smokes, her baby feels the effects. Because nicotine is a stimulant, it raises the mother's heart rate, blood pressure, and breathing rate. Nicotine also reduces the flow of blood. While a mother is smoking, the baby's oxygen is greatly reduced. Babies need oxygen as they grow, especially during the prenatal period. As a parent or parents who smoke during pregnancy usually continue to smoke after pregnancy too. Thus, the child continues to be affected by secondhand smoke. As for alcohol, doctors advise women never to drink alcohol during pregnancy. Any alcoholic drink, whether beer, wine, or hard liquor, can harm an unborn baby. Alcohol is a type of depressant which slows the central nervous system. A developing baby cannot process alcohol. Possibly taking even one drink may cause the baby to have birth defects. Fetal alcohol spectrum disorders, or FSADs, is a group of symptoms that occurs in babies whose mothers drank during pregnancy. FASDs are comprised of the following conditions. Fetal alcohol syndrome is at the severe end of the spectrum. These babies have abnormal facial features, growth problems, and brain disorders. They can have problems with learning, executive functions, vision, or hearing. Alcohol-related neurodevelopment disorder. These babies may have learning and behavioral problems, which is poor judgment and impulse control, often first noted near school age. And then alcohol-related birth defects. These babies often have problems with one or more of the following: their hearts, their kidneys, their bone, or hearing. The effect of most medications on unborn babies are unknown. Therefore, pregnant women should not take any medication without consulting her doctor. This includes prescriptions prior to the pregnancy, over-the-counter medications, dietary supplements, and herbal products. Taking more than the prescribed amount of a medication can be dangerous too. A growing number of babies are born to mothers using drugs like cocaine, crack, heroin, marijuana, ecstasy, and other hallucinogens. Some pregnant women may also be using powerful narcotics, which are pain-relieving or sleep-inducing drugs, with or without a prescription. Drugs can cross the placenta quickly and reach the baby. If a woman is addicted to drugs, chances are her baby will be born addicted to drugs too. Some of the effects of drugs that can be seen immediately in babies are early birth or death before birth, withdrawal symptoms like a high-pitched cry, shaking, twitching, vomiting, fever, trouble breathing, poor feeding, and rubbing the nose until the skin bleeds, damage to your baby's brains, their brain, their eyes, their heart, their limbs, their intestines, and their urinary tract, particularly with cocaine use. By the school age and teen years, children exposed to drugs during fetal development may show mood disorders and an inability to focus attention. In other words, the damage was done very early, but there was a silent period before the symptoms occurred. Besides the direct effects of drugs, pregnant women who use drugs often neglect their own health. In many cases, these women eat poorly, smoke, or abuse alcohol. Some never see a doctor during their pregnancy. For these reasons, babies whose mothers use drugs have a slim chance of living a healthy life. A mother's emotional health is important too, because it can also impact prenatal development. Positive thoughts and feelings are important for a woman to have a healthy baby. When a mother is happy and relaxed, her heartbeat and breathing are slow and her muscles are relaxed. Mothers who are relaxed have an easier pregnancy and delivery. About 1 in 11 mothers experience depression and excessive stress during pregnancy, called toxic stress. These mothers are more likely to engage in unhealthy habits, refuse any treatment for depression and stress, and skip their prenatal visits. The mother's stress hormones cross the placenta to the baby. In later stages of gestation, the baby can detect the changes in the mother's heartbeat and breathing rates too. The unborn baby can handle some stress, but if the stress is prolonged, frequent, or severe, it is dangerous to the unborn baby. Toxic stress may result in early birth and lower birth weight, lag in brain development, change in the epigenome, which can silence the gene that controls overproduction of stress hormones, which will make the newborn more easily affected when it comes to the actions of others. Fussy temperament and sleep problems, developmental delays, and behavioral problems. So, although some factors are uncontrollable during prenatal development, like genetic factors, environmental factors are often controllable. A healthy pregnancy is possible with support from family and friends, having a hazard free environment, adequate sleep, and proper medical and nutritional care. Okay? All right, that is the very end of Unit 5, Section 2. Thanks for listening, guys.